All righty. Well, hello, hello, hello. Is it that time again? Yeah, I guess it is. Very big happy Friday to everyone. Welcome to another week of Roswell Park's Ask the Experts webinar series. I'm Rebecca Vogt, Media Relations Specialist at Roswell Park Comprehensive Cancer Center in Buffalo, New York. And what a beautiful Friday it is if you're in the Western New York area. Oh my gosh, just gorgeous. I want to go outside and maybe eat my lunch after this. I don't know about you. To those of you who are joining us for the first time, we want to say a big welcome. Thank you so much. We are so happy to have you here, and we hope that you find today's webinar and any moving forward informative and helpful. And for those of you who are returning, we want to say a big old welcome back to you. We very much appreciate you coming back week after week to tune in and see what we have to offer up to you. And of course, covering new questions all along the way. Now, last week, something very exciting, we had the chance to discuss the importance of self-care, and we had Dr. Kate Glazer on, and she walked us through an easy yet effective yoga series that can be done right from your chair. Now, lucky for all of you, that video is available to view on demand on both our Facebook page, our YouTube channel, and then also on our website. That's roswellpark.org/patient webinars. You can check it out there. Today, we are all going to talk about another aspect of taking care of your health, and this is a big one, nutrition. Now, of course, many of you know that eating healthy is very important, but of course, it's often easier said than done. Listen, we've all been there, and especially, though, for cancer patients and survivors in unique situations. We are joined by one of Roswell Park's wonderful, wonderful clinical dietitians, Sara Jank. Sara, we want to thank you so much for joining us, and first, we want to give you just a little bit of time to tell us about yourself.
Absolutely. Thanks for having me. I'm excited to be here today answering nutrition questions. So as you mentioned, I am a registered dietitian. We have a great clinical nutrition team here, and we see patients in the hospital and in the outpatient clinics and over the phone as well. And we help with nutrition concerns leading into cancer treatment, throughout treatment, and into survivorship.
Fantastic. Thank you for that overview. Now, especially during the pandemic, as it still continues on week by week, certainly it can be very difficult to find the energy or even the resources to help improve our nutrition. I know time and time again, I think I've reached for a couple of Oreos in the pantry because, you know, let's just face it, it's kind of what's around and you don't really want to go out to the store. But in reality, though, it is more important than ever, especially for those individuals who are undergoing cancer treatment or those who have survived cancer. We are, of course, here to provide as much advice as possible in the next 30 minutes. We do have several pre-submitted questions that we will get to, but of course, there is always the chat feature, which is down below. You can access that little chat bubble to submit your own throughout our next half hour that we have here. When you send your question, make sure you send it to just the panelists, or if you want to, there is always the option to check the box anonymous if you do not wish to have your name associated with your question. That all being said, let's get started with this. Sara, actually, one question I want to ask first, because in your little introduction, you talked about, you're talking to patients, at the hospital over the phone. How busy have you guys been? Have you been taking a lot of phone calls during this time?
Yeah, so, we're definitely, like I said, seeing patients that are still in the hospital, but as well, doing phone consults. We have been, keeping up with our patients. We're here if you need to ask any questions. You can always call the dietitian office. And yeah, we're still definitely here helping during this time.
Of course. And why don't we touch upon, how important is nutrition for cancer patients?
Yeah, it's huge. Going into a cancer treatment, it's really important to make sure that you're going in well nourished, because that'll help you keep up your strength and your energy during treatment. And it can help you tolerate treatment so that it can help prevent any gaps in treatment if you're tolerating treatment okay. And again, making sure you're not losing any weight or muscle mass throughout treatment. Nutrition plays a huge, huge role in that. We do see some side effects nutritionally that people experience during treatment. So, finding ways around those to keep your nutrition up is going to be important throughout the whole course.
Absolutely. And since you already did kind of talk upon the fact that you guys are still, getting phone calls and meeting individuals in the hospital, et cetera, for those of individuals who are outside of the hospital, especially during this time, can you kind of share some sort of shopping tips right now, during, the COVID pandemic that people can take to heart?
Yeah, absolutely. So first, obviously when you're going into the grocery store, you want to make sure you're practicing social distancing, wearing your mask, things like that, wiping down high touch surfaces like the carts. When you're at the grocery store right now, sometimes you have to be prepared for something that you might want to be out of stock. It's definitely good to go in with a list. That's going to help for sure. And go to the frozen, try and get some of the shelf stable, the canned goods and things like that. But in the produce section as well, look for some produce that's going to last a little bit longer, so that you have things on hand like apples, onions, garlic, carrots, potatoes. Those are all fresh produce that you can kind of keep on hand without having to go back out to the grocery store and you've got some in your kitchen already.
I can't tell you how many times, Sarah, that I have reached for the onion that is in my fridge just to like add it into any sort of dish I have, and just lucky to know that I have it there just to add a little bit of flavor or seasoning to whatever I'm eating. So definitely a good tip there. So now a couple of things that are kind of coming from patients. First off, an individual going through chemo doesn't really have an appetite. This is a huge one. Any advice to lend to them?
Yeah, that is a great question. We see that pretty commonly, that appetite does decrease during treatment. And there's a few different things that you can do. One is to try to eat smaller meals more frequently throughout the day. So, you don't have to feel like you have to sit down to your normal, large meal portion. You can make that portion a little bit smaller, but then try to eat a little bit more frequently, or add some small snacks in between meals or before bedtime. Try to not fill up on liquids right before you're going to eat. Try to save the fluid for after the meal. That'll, help you not fill up too quickly. If you're able to, you can do a little bit of light physical activity about 10 to 15 minutes before eating. That can help stimulate the appetite a little bit. And really just kind of trying to eat more frequently. I know that the appetite isn't there, so it makes it difficult, but I've had patients who have found a lot of success even setting a timer or an alert on their phone just to kind of remind them to eat every few hours, even if you're not hungry. Again, it doesn't have to be a big portion, but trying to get some protein and calories in to keep that nutrition up.
Absolutely, 100%. So then you kind of have to talk about, there's sort of the caregiver side of it too. So a question coming in here so when my loved one was going through treatment, the individual only wanted to eat unhealthy foods, tried to get them to be healthy, but said that some calories are just better than nothing. Is that true?
Yeah. So, we do see that a lot, that people, are trying to, get in the fruits and vegetables, which normally absolutely I love. But when that appetite does go down, kind of our base level nutrition concerns that we're looking at are making sure that you're getting in enough protein and enough calories. Again, because going through treatment, we want to keep your strength and your energy up. Okay. So anything that you can tolerate, because the treatment's going to change what you can tolerate. You might have some taste alterations and things like that. So if there's, a lot of things that you can't tolerate as well, that's okay. You're going to just go for the things that you can tolerate, okay? Because we want to make sure we're getting those calories in. And we encourage people to have foods that are higher in calories, which oftentimes, foods that are higher in fat is an effective way to do that. So whether that's nuts and seeds, oils, butter, cream, full fat dairy, you want those calorie dense foods. Whereas, when you're looking at, typical healthy eating, you're looking for the foods that don't have a lot of those calories in them, or, the fruits and vegetables are less calorie dense. So there's definitely kind of different concerns there. Obviously, if you can tolerate fruits, veggies, absolutely, the more variety you can get in your diet, the better. But if you can't, you just want to make sure that your protein and calories are up there.
Do we still encourage the same amount of like calorie intake as someone would have, not being in treatment?
So your calorie and protein needs to actually go up when you're in treatment. So it's kind of that double-edged sword where your appetite goes down, but your needs go up. So that's why we want to make sure we're getting in those calorie dense foods.
Yeah. And of course, that's all individualized based on, treatment plan, that sort of thing.
Yep.
Okay. Okay. Good to know. What would be the most important thing to have in my diet as someone is going through treatment?
Mhm. Well, there's really no one thing that's, the most important or that's going to, make the most difference. I would kind of go back to, again, just the calorie and protein needs. Once those needs are met, you can try to get more of a variety in your diet. But that's where I would definitely start as kind of the most important thing, is making sure you're maintaining those needs again, so you've got your strength and your energy up during treatment.
One question coming in, I would like to pass along to you. How does someone eat a balanced diet when you have to be, there's like a lot of restrictions, having to be dairy, soy, and mostly grain-free due to dietary restrictions, digestive issues, what have you. Now I'm told to limit meat intake and eat more plants. What can I eat besides fruit and vegetables?
Hmm. So, a few of the things when we talk about that healthy diet and reducing meat intake, it's key that we're kind of reducing red and processed meats. So you kind of want to limit your processed meats as much as you can, which are things like bacon and lunch meats, red meats, which are, your ground beef, steaks, things like that. You want to limit to about 18 ounces per week. So you can still incorporate some of that. And then you can use things like, seafood is great to include in the diet, poultry, eggs, those types of things. And then on the plant-based side of it, beans are a good one. I think they mentioned limiting grains. For people that don't have to limit grains, grains are a good one. But really, those beans, nuts, seeds, fruits and vegetables, loading up the plate with those types of foods as well.
Right. Now, what happens though when nothing tastes good at all? I mean, that's, I'm sure, a very common question that you guys get, especially, with some people with the side effects of chemotherapy.
Mhm.
Everything tastes bad. I know my mom, the only thing that she could have when she was having chemo was soup, because it was the only thing
Mhm.
that didn't taste like metal to her.
Mhm.
So any suggestions there?
Yeah, so sometimes even just trying to flavor your foods differently, ways that you might not be used to, can help. If you have a lack of taste, adding more seasonings to things can help, or staying away from certain seasonings. Obviously it's going to be very individualized, but changing up the way you're flavoring the food might help. Depending on some of the issues you have, sometimes the temperature of the food or the texture of the food. So just, kind of experimenting with that on an individual basis, but changing those types of things can help as well.
All right. Perfect. Very important, because I'm sure, again, a lot of people go through that, especially if they go through chemotherapy and there's certain chemotherapy drugs are interacting with their taste buds and what have you. Speaking of which, though, I mean, going through cancer treatment, we always talk about being immunocompromised, but are there any foods that someone can eat to boost their immune system?
Mhm. So that's a great question, and one that we're seeing out there a lot more, right now, given COVID and everything. There's no single food or nutrient that's going to kind of quote unquote boost your immune system. We talk about compounds called phytochemicals, which are found in plants, and there's some of those, along with some vitamins and minerals, that are certainly essential to the function of your immune system, but no kind of one of them is going to individually help more than the others. So we recommend, just really trying to get a variety of fruits and vegetables in, and kind of back to those plant-based foods that someone else had mentioned, but really doing that and eating that variety can help you get those nutrients in. And even the different colors of fruits and vegetables signify different phytochemicals or different vitamins and minerals. So you want to get a variety of colors. If you've ever heard to eat a rainbow, that's really where that's coming from. And typically the darker the color, the deeper, the more intense the color, the higher it is in those nutrients.
Like my favorite, spinach. Sometimes I don't like it cooked, but I do like it on a salad. So that's one thing. Growing to like it in certain ways and how it's cooked and prepared. One thing to switch back just quickly to the chemotherapy. One question that's coming in is how long after chemotherapy does your body need to go back to normal? Like especially with like the taste too.
hmm that is highly individualized. So that's really going to be different for every person. And you can certainly, kind of talk to your medical team depending on your specific treatment, what the averages are for something like that. But, we do expect you to be able to start, taste to come back, adding some of those foods back in. And again, you can always individually meet with your dietitian to kind of find ways to add different foods back in too.
Of course, of course. Here's a big one, and so many of us take them in the morning or throughout the day. Should I be taking supplements?
That's a great question. Supplements aren't, we refer to the American Institute of Cancer Research, okay, and they recommend not to use supplements as sort of, a way to prevent cancer or anything like that. Essentially, most people can get, the nutrients that they need from food, and the goal is to get them from food first. Some people, might have certain deficiencies, especially with certain treatments. Your medical team might recommend that you take vitamin D or something like that. So absolutely, if that's the case, you need those supplements. But I would caution about adding supplements in, one, because they can interact with treatments. So if you're not taking, or even if you are taking supplements or you're thinking about adding a supplement, definitely discuss that with your medical team first so that they can, check if that has any interaction with your medications.
Absolutely. Yep. Oh, go ahead.
Oh, sorry. The other thing is that it is possible to get too much of a good thing too. So some of the vitamins your body stores, so you can get kind of too large of doses. So we kind of caution on that as well.
Yeah, for sure. And I know that some of our researchers have definitely been doing studies as it relates to supplements. And I know one recent one I think was supplements and breast cancer treatment and that sort of thing. So all stuff that there is active research that goes on at Roswell Park as it relates to all of these factors. So if you ever want to check those out, just let us know. We can, we post a lot of those on our website, especially on our newsroom when big research comes out. So for sure, check that out if you want to learn a little bit more about that. Now to kind of switch into, I hate calling them fad diets, but we do. I know we have a couple of blogs on this on our website. Kind of want to talk about keto first, and then we'll talk about the alkaline diet. So first on the keto side of things, would a keto diet help reduce fluid buildup in the body produced by chemotherapy?
So that's a good question. I am not aware of any research that would say that it would help in that sense. The ketogenic diet, for anyone that might not be familiar, is very high in fat. It's kind of moderate in protein intake and very low in carbohydrate. And there's really nothing to say that style of eating would help with fluid retention from chemotherapy. When you have fluid retention, we definitely recommend eating an overall balanced diet. It might be beneficial to you to monitor sodium intake, and again, make sure you're getting in enough protein so that you're well nourished as well. But the keto diet, there's really no evidence that would help.
Okay. Shifting sort of gears to, again, alkaline diet, intermittent fasting, doing juice cleanses or detox. Are these things that cancer patients and survivors should look into, or just what's sort of your thoughts on those?
Yeah, so across the board, I would say for most of those, there's really no good research behind jumping into them. The diet that we recommend, again, is from the American Institute of Cancer Research. It's largely plant-based, so lots of fruits and vegetables, whole grains, beans, nuts, and seeds. It limits added sugar, red and processed meats, and encourages physical activity as well. Some of those other diets might have some of those components, but might be kind of way too high on one or the other, or just might not work and might have you kind of following a very strict diet or spending money on things that you just really don't need or, aren't shown to help.
Alrighty. You talked a little bit about fruits and vegetables. One question coming in though, if this is something you can answer, if it's more individualized, just let me know. How long should a CAR T transplant patient avoid eating berries?
Mhm. So usually that's about 28 days after that transplant, but again, definitely an individual, and make sure you're connecting with your medical team on that.
100%. Should we avoid fresh fruits and vegetables during the pandemic?
So no, there's really no evidence that you need to be avoiding fresh fruits or vegetables. Certainly, absolutely wash your fresh fruits and vegetables during the pandemic and not during the pandemic. You always want to make sure you are, have good food safety practices, and that does include washing all of your fruits and vegetables, even things that you aren't eating the outside of, washing an orange or a banana before you peel into it. Things like that definitely can keep up, but there's definitely no need to avoid fresh fruits or vegetables at this time.
Good, because I still like eating my apples. What would be the best eating plan for someone with prostate cancer? I mean, is there anything that someone should be avoiding, something they should be stocking up on? Your thoughts on that?
Yeah, so really for all of our cancer patients, we do recommend that you follow those AICR, American Institute of Cancer Research guidelines as closely as you can during treatment. We talked in the beginning that might not be possible, but following those as closely as you can. For prostate cancer, one of the kind of strongest links in research actually has more to do with body weight than necessarily something specific in the diet, but we know that an overall healthy diet and, again, physical activity and things like that can help maintain body weight, which has kind of a bigger impact on risk with prostate cancer.
Right. So one of the things is, like, I know that, see a question coming in that I want to throw out to you, from a holistic approach. I know that, there is always the holistic and the mixing with Western medicine, that sort of thing. So from a holistic approach, is a medical mushroom supplement like mycoformulas for immune defense worth the investment at my local health store?
So that's something, again, that I don't know that there's a lot of research supporting. Excuse me, with something like a supplement like that, I would also, I know we talked about this a little, but I would also caution looking for supplements that have what we call a third-party certification, because some of these supplements aren't really regulated the same way medications are. So you want to make sure, if you are going to take something, that you're getting what you expect in the bottle and things like that. So definitely look at for third-party certifications. As far as, the mushroom supplementation, like I said, I don't know that there's any research to support that right now to make it, like you said, worth the investment. But again, you can always check in with your medical team on an individual basis.
All right. For cancers that are affected by hormones, like i.e. ovarian cancer, are there any foods that someone should be avoiding?
Not necessarily across the board. Again, kind of more specific individuals, we might, limit certain things in the diet, but across the board, it's not that, everyone has to avoid, soy is a big one that comes up, and for breast cancer patients as well. And we've seen research that says that there's really no added risk for soy, and there might even be some benefits there. So there's not a lot of foods that we would say, you definitely have to avoid like that.
Okay. Shifting from like active treatment to post-treatment / survivorship. I'm sure all these individuals, want to stick to eating healthy, but find it kind of hard to not eat what they want to eat. Any recommendations for their meals, advice to pass along to them?
Yeah, I think first I would say to not have too much of that restriction on yourself, to allow yourself to enjoy some of the foods that you do want to eat, because what we find is when we completely try to cut out the junk foods or something that you might be craving, You kind of substitute it with some of these healthier foods and put it off and put it off. And then when you eventually eat that food, you end up eating a lot more of it than you might have if you just kind of had, one cookie in the beginning when you wanted it. So part of it is just to try to not be so restrictive. And then certainly, kind of trying to fill up, foods that we, call our healthy foods, like fruits and vegetables and whole grains. Foods that have a lot of fiber in them tend to help you feel fuller longer, so they can help with hunger and things like that. But definitely, I think one thing I would say is to enjoy some of those foods, just kind of limit portion sizes, but don't try to overly restrict.
Yeah, absolutely. You are allowed to have that cookie. You can. It's totally fine. Like, just don't eat the entire sleeve, because sometimes
Exactly.
that's when it's not good. So, so is there a way to sort of like stop the cycle of like, extreme eating and then extreme like, extreme dieting versus like extreme like overeating bad things? Like how do we break that up? Or does that kind of really go back to the last question?
Yeah, definitely a little bit it does. If you're kind of not going so extreme in the first place, then you might have a little bit less of that kind of yo-yo effect. But another thing is just to kind of set very small, specific, reasonable goals for yourself. You don't have to change everything overnight, because a lot of times that will result in you kind of bouncing back the other way. You want to make it so that it is more, incorporated into your lifestyle. So, kind of focus on one thing, whether that's you're going to, add some veggies as a snack, as an afternoon snack, a couple days this week, something that makes sense for where you're already at. If you aren't eating any vegetables, you're not going to go to 3 servings a day every single day for the next month. Definitely take it slow and use some small steps, and that can help you kind of build into that healthy lifestyle pattern and hopefully decrease the kind of extremes that you mentioned.
That really kind of all goes back to what you were saying in the beginning about the 5 sort of meals a day, like spread apart, like I tend to find that that's pretty effective myself, because it keeps yourself sustained throughout the entire day. And like for little snacks, like you said, like grab like some baby carrots, or one of my favorite things to grab out of the pantry is just a couple of almonds, because they are very filling. So, and they really do kind of tide you over to the next meal for sure. One last question we want to put out there, because time has, of course, flown by, as it has with so many of our other webinars. It delves into sort of the budget side of things of eating well. So, healthy foods, so many people have the perception that they are too expensive. And then also there's the stuff out there about meal planning. There's so many companies across Western New York and across the United States that are offering meal planning services. But I'm sure some people who want to start to eat healthy and get on that kickstart to wellness, they may be concerned of the restraint on their wallets. So how does
Mhm.
someone sort of delve into all of it and really take that leap?
Yeah.
While still being fiscally responsible, I guess.
Yeah, well, I think kind of 2 parts of it. The first is just when you're, grocery shopping for healthy food yourself. It doesn't have to be more expensive. I know that there is that perception out there, but kind of like we mentioned, looking for the frozen foods. For fresh produce, trying to buy things in season. Even things like seafood, adding canned tuna or things like that. It doesn't have to be. I think a lot of people, that I've spoken with, kind of tend to go out and do this big grocery haul of all this fresh produce, and you may not really even be familiar with how to use as much of it. So, and then it goes to waste, and then it's kind of you're wasting the money. So trying to, plan ahead. So getting into the meal planning part of it. Having a plan going into grocery shopping can actually help save money quite a bit. But and on the other end of meal planning, it doesn't have to be this, full blown every meal every day is, all planned out. I think we do see a lot of that, and on social media as well, kind of like these perfect meal plans. And for some people that works. I know I would never be able to follow, something all the way through. So I think you kind of have to find what works for you. So meal planning, might be something to start with that can actually help save money a little bit. And then obviously you can kind of go to the other end of the spectrum with it. So, definitely something to look into, but not necessarily something that you have to, plan out every single full meal and buy the subscription service or anything like that right away.
And you'd be surprised how far certain things go if you do, like if you say you have some time on a Sunday to meal prep for your entire week, how far a bunch of black beans go, or,
Mhm.
again, how cheap like bananas are, and bananas you can throw
Mhm.
in smoothies and just cut them up and eat them. So what have you, all of that good stuff. Sarah, thank you so much for taking time out. We've hit the half-hour mark. Quickly before we wrap up, just want to say, do you have any closing thoughts you'd like to put out to our audience this afternoon?
Just, thank everyone for tuning in. And again, our team is here to help with any nutrition questions that you have.
Fantastic. Excellent. So thank you again. And then thank you, of course, to our audience members who continuously tune in, and everyone who is tuning in for the first time this afternoon. Now, if any of your questions were not answered, we always encourage you to reach out to your care team. They're always there for you, always able to get you the answers that you need, tuning into future webinars as we continue to broach even more topics and questions that you guys have all pent up in your heads and are hoping to get answered. We do consistently update our COVID-19 page on our website as well. Those have additional FAQs. If you want to check that out, that's roswellpark.org/coronavirus. Now, the video from today, as with all of our videos, will be available to view on demand, and then the link will also be sent to your email. Please stay tuned to roswellpark.org/patient webinars for our future webinars coming up, and also your email so that you can register for them, and also maybe nudge a friend and have them register as well. These continue to happen on Fridays. That all being said, have a wonderful Friday, a happy holiday weekend for whatever you're doing, so long as you're doing it with physical distancing, and enjoy your food if you're deciding to have a barbecue, but also, again, from this chat today, make sure it's nutritious and delicious. And again, thank you again for tuning in. Have a good day, everyone. Bye.